the number of people who are not wearing glasses is actually in millions. And that really affects the economy of the country,
Of course.
So it's really a global problem. If we really go on seeing the statistics, by the year 2050, 50% of the world population will require glasses.
Wow.
So that's almost half the world population will have some or other form of wearing glasses. So it's really scary.
So we try to kind of
all these tests.
I retired, and obviously, but thankfully,
All right, welcome back. It's Tell Me Why. With me in the studio is Dr. Sandip Mitra, who is an ophthalmologist and who's going to talk to us everything eye care, eye health, misconceptions and treatments. Dr. Mitra, how are you?
Great. Thanks and welcome for welcoming me here in Gulf News.
We're happy to have you. I feel like this is a topic that I've always wanted to discuss, to be honest. And first off, before we get started, I just want to get to know you a bit more. Why did you decide to become an ophthalmologist?
Well, it's a long story cut short. When I finished medical school in India, for example, where I trained, it's very competitive to get into any branch of medicine. The reason I chose ophthalmology is it's a combination of surgery and medicine.
Okay.
So it gives you an opportunity to go anywhere you like. So even if you're not a good surgeon, probably you can become a good medic, ophthalmologist. But later on, when I went into the field, I found it to be very fascinating because it's a microsurgery. It's growing every year. There's a robotic surgery which is coming in ophthalmology. So it really fascinated me a lot. And that was the primary reason why I went into ophthalmology.
Okay. And in your experience, I mean, you've had 20 plus experience now here in the country and abroad, I'm assuming. In your experience, how can we protect our eyes on a daily basis? Like simple things that are actually, that we take for granted, but that could actually protect our eyes.
So, I mean, it's a very important question, how to protect eyes, because without eyes, you don't see the world, you're blind. I think the most important thing is to understand what is the burden of eye problem in the world. If you just take the world statistics, not just UAE, the amount of people who are blind because of not wearing glasses is about in billions. It's about somewhere about 200 billion people who are not wearing glasses and they are blind.
Wow.
So it's a very, very important topic for us. As far as care is concerned, I think the most important thing is outdoor life. So you should have a balance between indoor life and outdoor life. That's very important. In case you have any problem, for example, you are not seeing well, you should immediately consult your optometrist or ophthalmologist and get your eye tested. So as far as eye health is concerned, from day-to-day basis, very important is try and balance your life. Spend time outdoors, spend time indoors. There should be more outdoors to indoors, which is difficult in Dubai, for example, because of the weather. The next most important thing is nutrition. So what you eat affects your eyes. So the more you eat vegetables, the more you eat green leafy vegetables, you take a lot of vitamins, omega-3, they all help keep your eye health good. Stay away from the screen. Like you have to stay at least 30 centimeters away. So the more closer you are on the screen, the more chances your eyes are getting fatigued. You tend to lose sight early in life. This is the other thing. Blinking exercises. So you need to have enough blinks.
Really?
So yes. So you should do at least every second one blink is important. So you should have at least, and when you are looking in an object, you actually forget to blink. So voluntary blinking, if you're working for half an hour, we say this 20, 20, 20, so 20 minutes of work, 20 seconds of break, and 20 blinks. That keeps the eye health.
That's so interesting. I've never heard that before. Like intentional blinking.
Yeah.
That's interesting. And why is that the case?
That's because, every time you blink, you actually produce the tear film into your eyes. And you sort of exercise the tear film which breaks with every blink and then forms again. So
Wow.
blinking exercises are very important because it maintains the tear environment, which is very important to see clear. I mean, if you don't have tears in your eyes, you actually don't see very well.
Yeah.
And that's the reason why many of us suffer from dry eyes in this country, because we are not blinking enough.
Yes.
So a simple blinking exercises really keeps you healthy.
I love that. I love that. So you mentioned that the number is in billions of people that go blind because they haven't taken care of their eyes or are not wearing the right glasses or haven't even paid attention to get their eyes checked. So do you have any like statistics that you can share, like how many people wear glasses and out of which how many actually led to blindness?
Yeah, there is a survey from Dubai, which is the Dubai Health Authority. We did a survey in 2023, which was just post-COVID. And they looked at the problem of errors, refractive errors, How many percentage of people in Dubai, for example, that's about 60 to 70%. That's pretty high.
Wow, that wear glasses.
They should be wearing glasses.
Okay.
It's not that everybody wears glasses, but that should be wearing glasses. So they have some or other form of refractive error. That means either they are short-sighted, that's myopia. That means they can see close objects, but they cannot see far away. Or they are long-sighted, like hyperopia, where they see far, little bit, but they cannot read. So all these combinations are very common in Dubai. But if you see the world statistics, for example, if you say US, for example, the number of people who are not wearing glasses is actually in millions. And that really affects the economy of the country,
Of course.
So it's really a global problem. And for your information, it is the commonest cause of blindness is
Not wearing
uncorrected
glasses.
error of refraction. So people not wearing glasses, they don't see the world well, and that is the commonest cause of loss of eyesight. So it's not a disease. It's just that you don't have proper glasses.
Wow. You would think it was chronic illnesses or, like external factors, but it's actually as simple as,
Yes.
an eye issue that has gone uncorrected or hasn't been addressed.
Yes, as simple as that.
Wow.
Yeah.
I'm just in shock. I think these statistics are very shocking.
Very shocking. And the problem is that if you see the world, the geography, the most people who suffer from myopia, that means the people who don't see objects far away, is the Asian community. So South Asian community, for example, people in Japan, Singapore, China, they have the highest number of people who wear glasses.
Okay.
This could be the indoor lifestyle, for example, or they are working more on the computers, for example. So these people do suffer from myopia a lot.
Okay.
And if we really go on seeing the statistics, by the year 2050, 50% of the world population will require glasses.
Wow.
So that's almost half the world population will have some or other form of wearing glasses. So it's really scary.
It is shocking. And there are so many conditions that can happen, or like so many issues that you can face when it comes to your eyesight. So we're going to mention a few, actually, and we're going to get into like depth into them. One that comes to mind is astigmatism. What is it? And like how do you treat it or manage it?
So if you take your eye like a ball, for example, a round, it's called sphere. That means the light, if it goes to the eye, it comes to a point. But if you imagine the eye like, not a ball, like a baseball, for example, that means it is curved more in one axis and it is curved less in one axis. This is what astigmatism is all about. So in these eyes, if you have astigmatism, you cannot wear spherical glasses. So you need to have a combination of spherical and cylindrical power. So that means you need to converge the light of rays in different axes to one point, and you need to have a different shape of the glasses. So astigmatism is a little bit complex, but in very simple term, it looks like you're not looking like a sphere, you're looking like a cylindrical world. So in one axis it is more curved, in the other axis it is less curved. But it is very well correctable with glasses, but we have to wear a combination of a spherical and a cylindrical glasses.
Okay, and how do you catch it? Like, how do I know if someone has it?
So the very simple test which you can do is, if you remember these old clocks, which used to hang on the wall,
Yeah.
those grandfather's clock.
Yeah.
And if you have these Roman letters written on them, and if you have astigmatism and you're sitting far away and you look at those clock and you look at those letters, you will see some of the letters are very clear and some are very fuzzy.
Okay.
So the letters which are clear is the letters which you can see because you have a spherical aberration there. The letters which you are not seeing is because of your astigmatism. So in some axes you are clear, in some axes you are not clear. And all we do is we just correct it with cylindrical lenses, and then we ask, okay, can you now see all those letters in the dial? And they say, okay, yeah, doc, I can see everything clear. And that's it. So one of the easy ways is ask somebody, are you able to read everything in the classroom? They will say, no, I read a few and I miss a few. So that's the way they catch astigmatism. So
Okay.
it's not that you don't see. You see most of them, but some you miss.
Okay, great. So the follow-up would be, then which tests should I do and how often? So, I mean, to catch anything that might be wrong with my eyes.
Look, if you say, when should we go to the doctor? So it should start from when you are a kid.
Right.
So in terms of what is the normal date when we ask the parents to bring the child is, we ask the parents to bring the child at the age of 3 years.
Okay.
That's the first time they come to us for eye evaluation. And then just before they go to school. So these are the two checkpoints. But there are also early evaluation. For example, some child have not straight eyes, They have squint, so the eyes are looking inwards. Or a child is rubbing the eyes a lot. Or somebody who is not able to see when the light is going down. Some children, they just keep banging when they're... So these are some extraordinary situations when we ask the children not to wait. Please bring the child immediately. You don't have to wait till 3 years.
Right.
Or, for example, you see the eye of the child and don't see the black ring there. So it appears whitish in color. Now, these are abnormal situations when we ask, no, you don't have to wait. You please come before that. Mm-hmm. Or if the child is having infections.
Right.
You keep getting styes regularly in a small child. We say, no, you don't have to wait till 3 years. You can come before that. So any of these situations, or if you, for example, the child is going very close to the TV to watch the television. Again, this is a red flag. So immediately you come to the doctor and visit the doctor. But what we say 3 years, and then preschool, and then every year in the school, we do visit. At least the nurse or the doctor should visit and check the child's vision.
Okay.
Then as an adult, for example, you should visit at the age of, let's say, at 30, 35, when then you need to go for example, like check your eye pressure, check whether you are developing glaucoma, for example, or you have any other disease in yourself, for example, hypertension, blood pressure, they can all affect eyes.
Yeah.
And then the early invitation to old age, that's 40. When you don't see things which is and you have to elongate your hands.
Yeah.
So that's again is the checkpoint. So these are the important checkpoints in life when you should go to the doctor.
I'm glad you mentioned that point because it brings us to our next, order of business, which is you mentioned that glasses can help you maintain good eye health and can actually help you prevent further complications. So then what happens if your eyesight is being affected by a chronic illness? So in the case of diabetics, it's diabetic retinopathy. I mean, what are other chronic illnesses that can actually affect your eyesight, and how do you handle it differently than someone that's going in for regular checks?
So what happens is, as an ophthalmologist, we are very much linked with other parts of medicine.
Of course.
One of them, as you correctly mentioned, is diabetes. Now, diabetes are basically, grossly are two types. One, which is insulin dependent, which starts early in age, and the type 2, which is non-insulin dependent, which starts later in age.
Right.
Now, if you are insulin dependent, you actually have to visit very early to the doctor because you start, let's say at the age of 15, 18, you start taking insulin. Every year you must come to an ophthalmologist to check your eyes. Now, if you are a type 2 diabetes, your diabetes is not diagnosed very late in life. So you come very late at the age of 35, 40 plus, even 50 years. Diabetes per se affect the retina. So the retina is the screen on which the images are forming. Now, if you are diabetic, For some reason or so, the eye demands more oxygen, okay? And in diabetic patients, the oxygen carrying capacity of the blood goes down, okay? So there are formation of abnormal blood vessels in the retina, which then can bleed. So it's very important for us to take pictures of the retina, make the patient aware, okay, you are diabetic, your retina is good, not to worry. No, you are diabetic, your retina is not good, you need to have close follow-ups. So it's very important for us to diagnose if you're having a diabetic retinopathy, and then depending on the stage of the retinopathy, we then advise what's the next treatment. It can be a laser treatment, it can be an injection, it can be anything, but you need to have a constant visit to us and your endocrinologist. So keeping your sugar down is very important, and keeping your appointment with ophthalmologist is equally important.
Absolutely.
So these are the two important things for diabetes.
Okay.
But there are other diseases. We have hundreds of diseases where our eyes are affected. So there are many other diseases.
Like any other diseases, chronic illnesses at least, that people are dealing with, have to look out for when it comes to their eyesight?
Yeah, for example, if you are hypertensive, okay, again, your retina can get affected because of hypertensive retinopathy. For example, you having any other rheumatoid disease, you have joint pains, okay, you have a problem with your spine, your eyes can get affected. You can suffer with severe dry eyes. You can not even being able to see in those eyes. So that's affected. Many neurological conditions, where you have, for example, multiple sclerosis. Patients have a problem with their nerve. Eyes can affect, and suddenly you can lose your eyesight. It's called optic neuritis. The patient has eye inflammation. Suddenly the vision goes down. And the problem is these are young individuals.
Right.
And that could be the first sign. You don't have any problem in yourself, and suddenly you lose your eyesight. And the ophthalmologist actually catches you, and then we diagnose multiple sclerosis or optic neuritis. We treat these patients with steroids. They do very well, and then we refer them to the neurologist for further management. So there are many conditions. Cataract, for example. Diabetic patients do develop cataract very early in life. Sometimes young patients, they come to us, Doc, my father developed cataract at the age of 80. Why am I having cataract? So we tell them, look, you have some other issues. You have some comorbidities. For example, you have hypertension, you have diabetes, you have thyroid disease. Now, all these conditions can produce early onset cataract.
Yes.
So there are many diseases which affects the eye if your body is not perfect.